Hey guys, how's everyone? Vinny from Physio again. I've got Christine with us here, and I'm just going to be asking a couple of questions. Christine, yeah? Can you let everyone know what was your main issues and why you were coming here for treatment?
So I have scoliosis, where my back is in an S shape of my spine, and I've been getting a lot of pain on my right shoulder blade, and also quite a bit of breathlessness whenever I go up the stairs or even just walking with a backpack.
Okay, now how old are you again?
I'm 22.
22, and you're getting breathlessness already?
Yeah.
Yeah, okay.
Yeah.
And how long were you getting all these shoulder problems for? Obviously you got scoliosis, had that for a bit, but how long have you been getting this really bad pain for?
So both the pain and the breathlessness, about 2 to 3 years.
Okay, cool.
And I never really did anything about it, I just brushed it off.
Yeah, okay. Yeah. And Christine's a nurse, so heavy work all the time, obviously.
Yeah, and repetitive movements at work, which just exacerbates how my shoulder blades feel. Yeah. And often makes me feel really stiff.
And so basically, I think that's why you finally came in, because your parents told you to come in, but it was, I think at work with all the repetitive stuff, it was starting to get hard at work for you now, right? Okay, cool. Yeah. So we had all that going on for about 2 or 3 years. The breathlessness, like you said, I think you were saying if you just go up a few steps or something like that, you'd feel really out of breath. Yeah, okay. What other treatments have you tried over the past few years to try to help, if anything?
So I mainly just went for deep tissue massages for my back, for my shoulder blade. It makes it feel really nice, but I found that, you know, spending a lot of money but not having the longer term outcomes didn't really work out for me. Yeah,
so it always feels good, obviously, when someone gets into it. It feels really nice.
It's like a quick treatment or a short term treatment. Whenever I used to get massages and spend money on that.
But like you said, you wouldn't get the long-term sort of shift or something like that.
Or changes in my body at all.
Okay. Yeah. So then you started to come here, which are Christine's parents, and so they said, asked me, do you think you can fix scoliosis? And I said, well, bring her in, we'll try it out. So when you came in, can you explain what were the main treatments we were trying with you?
So we started off with some hand therapies, where you pinpoint on your hands where are the sore spots, and generally what I've been educated on was they're all related to different parts of your body. For me, in my case, it was points on my back that I didn't know hurt and I didn't know were really tight. That was contributing to how sore my body was.
That's right.
So we focused a lot on that.
So then you would do it, and Christine was really good. I taught her what to do at home, so she was doing it religiously, so she was doing really well with it.
So what I've been doing is I've been doing the pinpointing of the hand therapies at home, and I've noticed that in the first 2 to 3 weeks, I think, my breathlessness was improving. Like I would physically and consciously try to go up the stairs or run across the road with a heavy backpack and see if I was going to get out of breath, and that all like started to gradually decrease. Up to the point where now, fast forward to today, I just recently went on a hike and I was not even out of breath.
Fantastic.
As bad as I used to be.
That's awesome.
And that's only after a couple of months in uni.
That's excellent. And then general back pain and all that type of stuff. How's all that now?
I feel a lot more flexible, and the pain on my shoulder blades, if it occurs, it's not like your 10 out of 10 is really bad to control kind of pain. It's a mild pain, but it's less frequent. It occurs less.
And when it happens, I think you can sort of control it as well, isn't it? Like through the hand stuff, even
through the hand therapies, because I'm able to identify which points are sore, and just give it a good couple of minutes to focus on that and kind of release the tension from my back.
Awesome. So that's really good. You had an awesome result so far. Do you have any advice or tips or suggestions for other patients that we're trying to help using all this type of treatment? Because like I always say, it's weird. It's different.
So be open-minded and don't be scared to try new things out. I really didn't know what I was expecting. All I knew was I wanted to get something done about my back, and just wanted to try something. And luckily enough, this all works out for me. So I'm really happy that I'm seeing Vinny for treatments. So yeah, just be open-minded, try new things out. It doesn't hurt to try new things out.
Perfect. Thank you so much. Awesome. And thank you again, guys, and take care, and we'll speak soon. Bye-bye.